My name is Katharina Kranzer. I work at the London School of Hygiene and Tropical Medicine as an associate professor, but I'm actually based in Zimbabwe, in Harare, and I'm site PI for the FIEBRE study, which is a multi-site study, and Zimbabwe is one of the sites. We work very closely in Harare with our partner, the Biomedical Research and Training Institute, BRTI, which also hosts our laboratory, which is obviously an important element or an important component of the FIEBRE study. FIEBRE works in 3 polyclinics in the southern high-density suburbs in Harare. We also are recruiting from Harare Central Hospital and from a district hospital which is in the town of Chichinguiza, not far outside of Harare. So putting all of that together, our field team, we have more than 15 staff in our field team, so that includes nurses, research assistants and drivers. In addition, we obviously have staff working at the offices. We have got a site coordinator who is also doing a PhD at the London School, Joanna, and we have got 3 laboratory staff working in the BRTI laboratory. FIEBRE has a big component, which is a diagnostic component, and then there is a qualitative for anthropology, ethnography research component. So for the diagnostic component, the laboratory is obviously quite important, but a lot of the diagnostic tests will be done outside of Harare because they are done at reference laboratories. However, for the FIEBRE study, we have established a blood culture service. We are using an automated blood culture machine, and that is at the moment one of the few functioning automated blood culture machines all over Zimbabwe. So because of that real asset and because of establishing a quality managed microbiology service, we have been contributing to the knowledge and understanding and epidemiology of the typhoid outbreak, which has been ongoing in Zimbabwe since the beginning of 2018, or even a bit earlier than that. We have altogether now isolated about 130 Salmonella typhi isolates, mainly in outpatients. And since there has been a mass vaccination campaign in March 2019, we have seen massive reductions in Salmonella typhi cases in children, but we are still finding quite a lot of Salmonella typhi in adults. Most of the Salmonellas are actually ciprofloxacin resistant, and that's something which is new for Africa. So ciprofloxacin used to be the first-line treatment in Zimbabwe. So now within the clinics in these high-density suburbs, through this kind of generation of real-time data and feeding back these data to actually impact on patient management, we have really shifted from a lot of prescribing of ciprofloxacin to actually azithromycin. And sometimes the clinics obviously run out of azithromycin, and then we are topping up the treatment of these patients. The reassuring bit is that, as I said, we have seen reducing rates in children, but we will have to see if that is a sustainable impact of the vaccine or not. Apart from Salmonella, which seems to kind of keep us quite occupied, and we have fed back these data to Harare City Health, obviously, and the National Reference Laboratory, and we work in close collaboration with them, and have also had several presentations to the National Association of Physicians and at the University of Zimbabwe to really kind of disseminate these data. We also do cultures for tuberculosis, which is still quite a massive problem, especially in HIV-infected inpatients, so disseminated tuberculosis. We are also, the results we are feeding back is point-of-care malaria testing, and obviously Harare per se isn't a big malaria area, but when we have returning travelers, and people do travel, especially also for boarding school, but also do travel to other countries, cross borders, we find in these patients positive malaria tests, and then obviously that is fed back as well. Other tests we do in the laboratory itself is cryptococcal antigen testing, and obviously that's also mainly in HIV-infected individuals we find positives. The laboratory, otherwise we store a lot of samples and we will investigate and do different diagnostic tests on these samples later in the course of the study. So far we have recruited more than 1,300 patients, and we are also recruiting controls. Among those 1,300 patients are adult inpatients and outpatients, and children inpatient and outpatients. We are aiming for a total of 2,400, and soon we will have reached our target in a recruitment target in the adult outpatients. So we anticipate to complete recruitment sometimes next year, and we hope that we can keep the laboratory work or the laboratory service which we have established at BRTI going through other studies, because it's a real asset.